Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another great show for you tonight. We're going to talk about fungal infections. It's a very common problem, and it used to be something that we didn't talk about or that we may not have known a lot about. But in recent years, we know more and more about it, and we're going to talk about it tonight from A to Z, as I usually say. First, let me talk about sharing and caring. Remember, med moments is a big issue. And what is a med moment? That moment when you, for instance, if you had that chest pain and you know that is serious, you need to see your doctor. That is a med moment. I trust that each and every one of you would come onto the website and share your med moments with me so I will know what we need to talk about on this show, and that way we can be more pertinent to your medical problems. Remember, OBHealthy.com. That's the website. And hit me on Facebook. Obey Your Doctor. It's all out there. I'll be happy to hear from you, and we'll get back to you. All right. So there's a little thing that I want to talk about today before we get to the main topic, and that is when to quit smoking, or why should you quit smoking, and what will happen after you quit smoking. Let's talk about what happens after you quit smoking. 20 minutes after you quit smoking, your heart rate decreases and your blood pressure decreases, which is very, very important. 8 hours after you quit smoking, you have decrease in your carbon dioxide, which is that gas that we produce because our cells in our body have a certain metabolism, and we have to get rid of carbon dioxide. Oxygen levels increase. 48 hours after quitting smoking, your nerve endings start to regrow, and the ability to smell and taste starts to return. 2 weeks to 3 months after you quit smoking, blood circulation improves, lung function improves. 1 to 9 months after quit smoking, coughing and shortness of breath decreases. And that cilia are those little hairs in our airways that allow our mucus to come to mobilize so we can cough it up effectively. They start working better. 1 year after quitting smoking, the risk of heart disease or heart attacks decrease. And 5 years after quitting smoking, the risk of stroke decreases. And the big one, 10 years after quitting smoking, your lung cancer, the chance of lung cancer decreases, as well as other cancers, such as mouth and throat cancer, esophageal cancer, bladder cancer, and cervical and pancreatic cancers. They decrease as well. Well, those are some very important reasons to stop smoking. All right. I'd like to get to the main topic as far as our show tonight, and it's fungal disease. And I have the best person that I know of to talk about this disease. His name is Dr. Christian Engel, and he's an infectious disease specialist. Dr. Engel, welcome to our show.
Oh, thank you so much.
All righty.
Thank you.
All right. Well, is this your second show or third show?
I think this is my second show.
Second show. We had to get you back. I told you that.
Oh, it was a pleasure the first time. So.
All right. All righty. Well, the thing of it is that fungal diseases, they're probably not talked about enough. We know about them. And especially in my practice, being a lung practice, I see them as far as the lungs are concerned, but it's such a broad range of things that we can talk about when we talk about fungal infections. So first thing I'd like to do is I'd like to ask you, what is a fungus? Or fungus among us, as you told me the other day.
Fungus among us. I think that should have been the name of the show.
Yes.
So fungi are cellular organisms or groups of cells that live together.
Okay.
They're somewhere between human cells and bacteria. Fungi, which is many funguses together, get a bad rap. There's basically three groups. There's the mushrooms that we love to eat, but can kill us if they're poisonous.
Right.
They're the molds that give our blue cheese dressing, that tangy taste, but can also kill us if we get them in our lungs.
Right.
And then there's the yeast that helps our bread being baked, it helps our beer being brewed, and it can in fact also kill us if we get it as an infection. So they're good and bad.
Good and bad. That's two ends of the spectrum. And one moment I'm thinking of things that I really enjoy. Beer.
Exactly.
You know what I mean?
Oh.
Certain cheeses I love,
Yes.
love. And then at the other end of the spectrum, if it becomes a pathogen or something that's harmful to the body, it could
Exactly.
actually kill us.
It can absolutely kill you.
Interesting, interesting. So why does or how does that transition happen from something that's so good as far as nutrients are concerned, but can be so bad as far as a pathogen that would attack certain aspects of the body?
Well, there are thousands of different types of fungi.
Okay.
And some we have learned to use to our advantage, as in cheese and when we make bread or beer. And some we don't want near us. And quite frankly, sometimes we don't want them near us because they give us athlete's foot or toenail infections. And other times we don't want them near us because they can give us lethal lung infections.
Right. Tell me, is there a difference? I understand that we had talked, we've talked about many things in the past. Bacteria and viruses, how are they different from fungi?
A fungus, the cells, the fungal cells have a cell wall. And are a little bit more like human cells than the bacteria and the viruses. And that's important because it makes it more difficult to find antimicrobial agents or drugs that kill fungi because you might hurt human cells too because they're so similar.
Okay. Do they divide like our cells do? You understand what I'm saying?
Yes. They divide. They have a cell wall, so they're a little bit different, but they divide more or less like our cells.
All right, then. Now, what about times when, if you, for instance, if I was, I see patients in the office.
Yes.
And a lot of patients come in the office and they complain of a little sore throat. And I look at their tongue and I see that it's covered coating. I can't figure out sometimes why one patient may have coating and another patient may not have coating. And I understand that that is a fungus. All right. How does that happen? And I know it's a fairly common problem. What happens that causes that for us?
So that's what you're talking about is thrush, which is called a yeast. And it's really the same type of infection that women get as yeast infections.
Oh, okay.
And different people, for some reasons that are obvious and some that we don't really know, respond differently to the yeast. If you are very young or elderly, if you have diabetes, if you're immune suppressed, then you can actually develop a yeast infection, either as thrush in your mouth or a vaginal yeast infection. But having said that, some people, for reasons that are unclear, develop yeast infections more readily than others.
And what do you have to do for that? I mean, is there a way that you can prevent? Are there foods that you could eat or something that you could do to help keep that away or prevent that?
Well, it depends what your risk factors are. Certainly you need to treat it, but to prevent it from coming, if, for example, you're diabetic and you get thrush, if, for example, you have HIV and you get thrush, you can improve your underlying disease, thereby reducing the chances of you getting a yeast infection in your mouth or thrush.
Okay. These type of infections, are they usually always mild, or sometimes for some reason, it can get worse? Like, you understand what I'm saying?
Yeah.
Are there certain funguses that are just going to be, no matter what you do, they're going to be horrible as far as the body is concerned, or it's going to create a very difficult infection, and then others that won't, or no matter what type of fungus it is, it can be very deadly?
I think, so In the air around us, there are lots of molds. There's yeast on everything we touch.
Right.
So yes, there are some fungi that are more dangerous than others.
Okay.
But even one of the most dangerous molds that we have, Aspergillus, doesn't need to be a deadly infection. Sometimes it just gives a little bit of an allergic reaction.
Okay, all right then. Is there any age that's more susceptible?
The very young and the very old are more susceptible to yeast infections. But as I said, if you have underlying disease, anyone of any age can have fungal infections.
Is it because the young, their cells or their body's just not able to fight it off, or is it there's another reason that they are more
it's the
susceptible?
immune system takes time to mature in the first year of life. So little kids can develop fungal infections. We many times see it as cradle cap. They can have some thrush.
Oh, okay.
The elderly, again, their immune systems as they get older weaken, and they can develop fungal infections.
You know, you say these words, and I never think about what it is. Cradle cap. I mean, it's such a common word that we throw out there, but you don't think of it as a fungal infection.
Well, it's not just an infection, it's also the immune system. So it's like many fungal infections, it's really the immune system playing with the fungi together that give the...
Okay. What about gender? Is there any, are males more prone to it than females, or, you know what I mean, just because of where they are or the type of work they do, or you know what they do?
Well, it depends on the fungus. Overall, I'm not aware that there is and that doesn't mean there isn't. It's not more common in one sex or another. I'm just not aware of that.
Okay. Race. Does it play
I'm not aware that there are any racial differences.
Okay.
I think the fungi are equal opportunity.
Equal opportunity. Okay. And where you live in the country, or if it's high altitude or low altitude, is that a change?
Yeah, absolutely. So there are some fungi that only exist in certain parts of the world. For example, there's a fungus that causes valley fever out in the California Valley or in Arizona, and you can only get it if you go there. It's called coccidiomycosis. There's also a fungus called histoplasmosis that's only in the Mississippi River Valley, so all in the middle part of the country.
Right. Right. All righty. How do most patients present to your office if they come in with an infection? I mean, are they complaining of pain, or are they itching, or are they all red in the face, or are they, you know, how do they come in?
Well, when you talk about fungi, it can be very scary to hear that these organisms can be very deadly.
Right.
But the fact of the matter is, whether you're a lung doctor or infectious disease doctor, the vast majority, or a primary practitioner, the vast majority of patients that you see with fungal infections, the fungal infection is an annoyance or a cosmetic annoyance. It's an infection of the nails. It's athlete's foot. It's dandruff, it's thrush, it's a vaginal yeast infection. And these infections are not life-threatening in any way. They're just a nuisance. We've all had fungal infections at one point or another.
Okay. You said a word earlier that kind of flew over my head there for a minute. You said immunocompromised.
So
what does that mean?
An immunocompromised patient is a patient whose immune system isn't functioning. Okay. And we all want a strong immune system.
Now, immune system is that system in our body that allows us to fight infections.
Absolutely.
Okay.
Absolutely.
Okay. Now, so when that isn't working appropriately, or that's not up to par, then the body cannot fight the fungal infections off.
Exactly.
All right,
exactly.
All right. So they spread, and now can I be walking around and touch you and get your fungal infection if you had one? Not saying that.
Again, it depends on the fungal infection.
Okay.
For example, athlete's foot can be spread in locker rooms.
Okay.
So certainly can spread that way. The deadly type of fungal infections, quite frankly, rarely spread that way.
Okay.
So I see patients with deadly fungal infections all the time, as do you.
Yeah.
And we generally are not scared of getting it. And the loved ones of those patients shouldn't be frightened either.
Okay. Good. When you have fungal infections, like for say, of the skin, how do you treat those basic fungal infections? What do you do for them? What type of medications are we using to treat those type of fungal infections? Just the basic ones. We'll get to the others.
Just on the skin, you can actually treat those fungal infections with over-the-counter medications. You can buy creams or sprays. For example, athlete's foot is probably the most common.
Right.
You can buy over-the-counter sprays that have a medication in them or a type of medication in them that kill the fungi.
There are two words that we use quite often, words like yeast and mold. And then I hear this word fungi. How do they play?
So fungi describes both yeast and molds, and for that matter, what people call mushrooms.
Okay.
So all those three words are grouped in under fungi.
So fungi is like an umbrella term.
It's an umbrella term that describes both yeast, molds, and mushrooms.
Okay, all right then. Now, other places that you may get infections with the fungi. What about the eye? Is that something that we should worry about? I know that sometimes you can get a virus in the eye, and if you have a pink eye, you rub this eye, and then you put your hand over here, and you got two red eyes. So fungi are they the same, or fungus?
Yeah, fungi can give you eye infections. They can give you infections in the eye, but typically when that happens, you've had a more severe infection in the rest of your body, and they've spread to your eye.
Okay, all right. And things like sinuses, I know when you start talking about thrush, then I think about the sinuses and what's in the back of your throat. Can it give you a sore throat, that type of stuff?
Diabetic patients are more prone to getting fungal infections.
Okay.
And they can get quite severe sinus infections with molds. That's very concerning when that happens.
All righty. Now, tell me about, I know that sometimes you also stated that with females, the vaginal infections sometimes, or the yeast infections. Why does that happen? Why does a lot of my patients come in and they say, well, when I take an antibiotic, oh, you doc, and I'm just worried about taking this antibiotic because I may get a yeast infection. What actually happens?
What actually happens is that, like any ecosystem, the forest in one of the reservations or the jungles in South America, if you disturb it, bad things can happen. And when you take antibiotics, you destroy the ecosystem in the vagina, really, and the bacteria get killed, and something takes its place, and that is, quite frankly, the fungi that come in and can flare up when the good bacteria that you have in your vagina on a regular basis are killed.
So what you're saying is that in our bodies, we actually have good bacteria and bad bacteria.
Yes.
And if I take an antibiotic, that antibiotic is not smart enough to just kill the bad bacteria.
Exactly.
It's going to kill some of the good bacteria too.
Exactly.
And because in our bodies there's a harmony between fungi or fungus and bacteria, once the bacteria is killed and it's not holding the fungi back, the fungus grows more.
Exactly. That's perfect.
So that's a
that's a great way to explain
all right,
it.
I had to think through that one.
Oh, that was great. I loved it. I'm going to use that.
What about, we all have pets at home. Dogs, cats, we may be on a farm, we have cattle. I know that one of the fungi is, it's called tinea, which you said, athlete's foot, and the fungus that gets under your toenails or your fingernails. Are they associated with some of our pets? Can they give us that type of fungus?
I would have to say I simply don't know. I have 3 dogs.
Right.
I used to have 2 cats, and I wouldn't be surprised, but I simply don't know.
Okay, all right. That's something I worry about, because the reason I asked that question was because I know a lot of seniors have pets. A lot of pets are around small children. And I was just wondering, because, they're all over us, you know what I mean, whether that would be a problem as far as our pets are concerned.
I'm not sure. I'm not sure.
Okay. Tell me some of the symptoms that you see with fungal infections. I know that some of the infections, one of them is called versicola.
Yeah, tinea Versicolor.
Yeah, I had to get that one under. And that actually changes your pigment or causes
Exactly.
dark areas and stuff. Like, what are some of the other symptoms that you may see?
If you have a skin infection with fungi, you will typically see either redness of the skin or a lightening of the skin.
Okay.
Where the skin loses its pigment, its coloring, and it actually can turn white or it can turn darker.
Okay.
And typically, you'll also have itching, pain, or burning. If the infection goes on for a long time, which you have oftentimes in the nails, the nails can actually turn a whitish, opaque color.
Okay. All righty. And I know that we've been talking about the superficial, what they call cutaneous, meaning on the skin.
Yes.
Infections. There's another category that I was reading about called subcutaneous, which means under the skin. How does that fungal infection usually occur? Is it because you got stuck with something, or because, you know what I mean, you had an open cut and it got in? How does it usually get under the skin and get going that way?
Well, fungal infections can get under the skin in a lot of different ways. Okay. So if your immune system's not very good, what initially in people would be just a skin infection can actually go deeper and can become quite severe. However, in other situations, for example with blastomycosis, which you see, that's a mouthful.
That's a type of fungus.
It's a type of fungus.
Okay, blastomycosis. Okay.
It can go in your lungs and then spread to the skin.
Okay. So it could actually, once it's in your body and in your lungs, it'll cause a lung infection?
Yes.
And then from there, it actually gets in the blood and travels around?
It gets in the blood and travels around, and it can go to the skin. Other types of fungal infections can go to the mouth. So there's so many fungi, and that's part of the trick of being an infectious disease doctor, and they can present in so many ways. So you really always have to think of fungal infections when you have a patient in the office.
Okay. Can these give you like very high fevers and stuff like that?
Oh, absolutely, absolutely. Any fungus, if your immune system is weak enough, can really be deadly.
Okay.
They actually used to use baker's yeast, a type of brewer's yeast rather, as a way to prevent your bowels from becoming irregular. And you would take them in pill form, and you would take them in, they would go into your belly, and they were supposed to make you regular. And there was one case of someone who had such a bad immune system that yeast got into their blood and made them very sick. So it depends on the patient as well as the fungus.
Okay, all righty. What about as far as, and I'm going to call this systemic infection, and that's the third type, meaning that it really got into the bloodstream and it's doing its thing, bad things.
Yeah.
I read that sometimes it's difficult to determine whether fungal infections from tuberculosis. Does it have? Number one, are they similar? Are they connected, or they just look alike? And there's some of their symptoms.
You know, when we're as doctors, we look at X-rays, and sometimes the findings when someone has lung problems on the X-rays can be very similar between tuberculosis and fungal infections. They can cause a big hole in the lung, called a cavity.
Right.
And as if you just look at the X-ray, you won't be able to tell the difference between tuberculosis or a fungal infection.
Interesting. So the lung infections, then we would have to give a certain medication, and it would have to attack that fungus in the lung and kill that fungus at that particular.
Yes.
Why does it cause cavities? What's first a cavity? Tell me what I understand what cavities are from from pulmonary. The scarring, and the scar pulls and it forms the cavity. Yeah. But why is it sort of a chronic disease that it would be there long enough to form that cavity?
It can be a very chronic disease. It can also be a disease that happens suddenly. But if you have a strong immune system, then it can be an ongoing disease. I know in parts of this country where we do have a lot of what we call, it's a long word, but endemic fungal infections, like the Mississippi River Valley,
Right.
Ohio River Valley, you can actually see in a lot of patients, if you look at their x-rays, a lot of people who are absolutely healthy, you can see little dots from fungal infections, and they would never know that they had had a fungal infection.
Okay, all righty. So in healing, in the body healing, there are certain gifts it leaves behind, I should say, like the scarring on the
scar
lung
tissue,
tissue,
and
and you may have some certain shortness of breath and stuff like that, just because you had a fungal infection.
Exactly.
Fungal infection.
Exactly.
Interesting. Very interesting. So we only have about 30 seconds to go, but what about treatment? Treatment for most of the fungal infections is a sort of not antibiotic, but antifungal, or?
When you have fungal infections on the skin, usually treatment will be a cream.
Okay.
When you have it on the nails or systemically, usually we have to give you pill form. If you have it in the mouth, sometimes your doctor will just give you some tablets that you can suck on, and that will take care of the infection, the thrush in your mouth.
Okay, all right. Doctor, thank you very much.
Oh, it was such a pleasure.
I'm telling you, every time you come, I learn more and more. I'll tell you, very, very interesting. Well, let's talk. Knowledge is key, but action is power. Remember, obey your doctor. I'd like to say also, never institute any change in your medical care until you consult your physician. Sharing and caring. Remember, obeyyourdoctor.com. Go ahead and email me. And Facebook, Obey Your Doctor. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.